Hi, I'm Tom Douglas. Today is Friday the 24th of May. Today I'll be demonstrating respectful and realistic verbal communication in the form of a patient handover to a marker paramedic and a notification to hospital's emergency department. Hi Cam, I'm Tom. Today we have a 45-year-old male patient named Adam Jones who lost consciousness in a cherry picker and had a fall greater than 3 metres at 15:45. Adam lost consciousness for 3 minutes and when he regained consciousness complained of sharp left chest pains and left lower leg pains. His main complaint is the chest pains and is at 8 out of 10 on the pain scale and is giving him difficulty in breathing. Adam's a diabetic with no allergies and does not take medication, but has been generally unwell the last couple of days and did lose consciousness last night. In inspection of his chest, I found on the left side and ribs bruising and emphysema, as well as swelling and bruising on his left lower leg. As far as treatment goes, we placed a cervical collar on Adam, as well as oxygen therapy using a Hudson mask at 8 litres per minute. We also placed an IV line in his left antecubital fossa. With that, we administered 5 milligrams of morphine, which brought his pain down to 6 out of 10. We repeated that, but it had no effect. We also spinally immobilised Adam, as you can see him right now. I also took a vital sign survey and found that Adam actually is deteriorating. His heart rate has increased from 116 beats per minute to 124. His blood pressure has decreased from 95/70 to 90/60. His respiratory rate has increased from 24 breaths per minute to 28 breaths per minute with increased effort. His skin is cool, pale and moist. His glaucoma score has decreased from 14 to 13. His eyes are pearl. His oxygen saturation has decreased from 88% to 85%. His temperature has remained constant at 36.5 degrees. His BSL has remained constant at 5.4 millimoles. His air entry is good on the right side, but is reduced on the left side, and now there is nil air entry to the mid zones. Overall, we believe that Adam was presenting with a collapsed lung and needs to go to the hospital. Over at hospital, we have a 45-year-old male patient who's had an accident at the workplace. The patient had a fall greater than 3 metres from a cherry picker and has suffered trauma to the left chest and ribs as well as the lower left leg. The patient is a diabetic but doesn't take any medication and does not have allergies. The patient is having difficulty breathing and deteriorating. His heart rate has been increasing. It's now at 124 beats per minute. Blood pressure dropping and is at 90/60. Respiratory rate is increasing at 28 breaths per minute with increased effort. Oxygen saturations has decreased and is at 85%. Air entry is good to the right side, but there is no air entry to the left side mid-zones. As far as treatment goes, we have applied a cervical collar and a Hudson mask oxygen therapy at 8 litres per minute. We've also administered 5 milligrams of morphine through IV and repeated that, as well as spinally immobilising the patient. We are transporting the patient now with an ETA of 6 minutes.